Assalamu alaikum. Palliative care medications. Palliative care looks to help improve and support a person's well-being in all aspects of their life, not just the physical. It aims to treat the person as a whole by managing their symptoms, as well as finding ways to support their emotional, spiritual and social needs. Sometimes people worry that by receiving palliative care, doctors will stop all other treatment. In reality, palliative care very often runs alongside medical treatment and may even help to prolong life by reducing the negative burdens of treatment on a person's physical and emotional well-being. In the case of the coronavirus, we do not have a cure for the damage it causes to a person's body. Instead, when a person is not improving and it's clear that they are in the last days of life, the focus is on managing its symptoms and relieving them, such as fever, breathlessness, cough and confusion. Managing the symptoms of any life-threatening illness involves a range of different approaches to ease comfort, including medications. Important non-medical things can include making sure that the room is a comfortable temperature, the person is well positioned, and any emotional or spiritual worries are managed and they are cared for with compassion, love and dignity. Your doctor may suggest having palliative care medicines available. These medications are injections, as often people cannot take tablets when they are very weak and unwell. They may include morphine for pain, medicine for confusion that makes a person more relaxed and sleepy, and anti-sickness injections. Some family members worry that these injections will make a person unconscious or even end a person's life before their time. In reality, as a person deteriorates, it is very natural to become more sleepy, and when used correctly, these injections do not change the process of dying, but can help a person be more comfortable during the journey. If you have any worries or questions about the medicines, especially if it is important to you that a person remains as awake as possible, please speak to the healthcare professional who is prescribing them. In the end, we believe in Islam that every disease has a cure except old age and death. So when we know that death is close by, palliative care medicines allow us to be more physically comfortable, and so that we can focus on what matters in terms of spiritual preparation.